Hello, my name is Rebecca Boughton and I am one of the registrars in Obstetrics and Gynaecology and also an RCSI clinical tutor. Sometimes a scan at 7 weeks can confirm a miscarriage if your baby has grown to a size where we would normally expect to see a heartbeat. However, sometimes the diagnosis is uncertain and you will require further ultrasound scans, often 1 week apart, to confirm whether the pregnancy is going to continue or not. We understand that this can be a very stressful time for patients waiting to find out whether or not your baby is going to be okay, and our early pregnancy unit is here to support you. If you have a positive pregnancy test and they are unable to see your baby on ultrasound scan, this could be for the following reasons. It could be that your dates are incorrect and you are actually much earlier than you think. In this situation, it will take time and further scans before you'll be able to see your baby on the ultrasound scan. In some circumstances, it could be that unfortunately you have had a miscarriage and your baby is no longer visible on scan, or maybe didn't grow big enough to be ever visible on a scan. In these situations, you will normally have some vaginal bleeding. Less commonly, you could also have a pregnancy that is implanted outside of the womb. This is also known as an ectopic pregnancy. In this situation, your doctor will counsel you on what further investigations such as blood tests or further scans that may be needed.
Hi, my name is Debra. I'm one of the advanced midwife practitioners here at our emergency and assessment unit at the Rotunda Hospital. Many of you will know my face from coming in and out, hopefully for good reasons. I work in the unit for the last few years, and I see a lot of early pregnancy patients coming through our department. Most of the time I give some really good news. Sometimes I give some bad news, which can be very, very difficult. So I suppose we see a range of patients from 0 to 42 weeks pregnant. Sometimes we see patients after when they have their babies, and sometimes we see babies for the first 2 weeks of their life. Part of my role is to assess and care for women in early pregnancy when they present to our emergency department. Women present to the emergency room in early pregnancy with complications such as pain, bleeding, and nausea and vomiting in pregnancy. To the emergency room with symptoms such as bleeding or pain, you will be triaged by one of the midwives. Your history will be taken and a set of vital signs will be taken also. The amount of bleeding will be assessed, and the level of pain that you were in at that time will also be assessed. Once your triage assessment is performed, you will be seen by usually myself, an advanced midwife practitioner, or one of the senior house officers or registrars at the emergency department. If you have symptoms such as bleeding or pain, a scan will be performed to assess the pregnancy. If you are over 6 weeks, after 6 weeks, usually a transabdominal scan, which is a tummy scan, will be performed. If you are less than 6 weeks, we may offer an internal scan if required. If you present to the emergency room with pregnancy of nausea and vomiting or hyperemesis, an assessment is made and you may need to have a cannula or a drip put in your arm, and we may give you some fluids and some anti-sickness medication, sometimes in through a drip or an injection, depending on how much you're vomiting. You're kept with us for a few hours, and an assessment is done by either one of the SHOs or the advanced midwife practitioner, and a scan is also performed when you come in with nausea and vomiting, just to ensure that we have a viable pregnancy there and make sure that you just have one baby or 2 babies in some occasions with hyperemesis.
Hi, my name is Karen Flood. I'm one of the fetal medicine experts working here in the RCSI Department of Obs and Gynae. Typical symptoms of a miscarriage are bleeding and pain. And we do advise, if the bleeding is very heavy or very painful, that you attend the emergency room for assessment, but normally it's usually spotting. Now, this can be very normal in pregnancy. However, we do advise an early scan to confirm that the pregnancy is ongoing. There are some miscarriages, however, where there's no symptoms at all, and there might be a surprise finding at an ultrasound scan. Sometimes, however, there might be some indicators such as brown spotting or loss of pregnancy symptoms. So in that situation, we'd advise you tend for an early scan to assess the pregnancy. To try with the next cycle, but as I said, I would advise that you wait for a normal period first, because understandably with the next pregnancy you're going to be anxious and an early scan would be advised. So it's very important that we are uncertain of your dates, because if we're uncertain then it adds to unnecessary extra stress and worry. So it just makes the scan a bit more accurate. Advised looking at the Irish Miscarriage Association there's very good links there for local services for support if needed.
Hi, I am Fiona Cody and I am a specialist sonographer in Obstetrics and Gynaecology. I work in the RCSI Rotunda Department of Fetal Medicine and Ultrasound. I'm here today to answer your questions that you sent in on ultrasound-based topics in pregnancy. Here in the Rotunda Hospital, we have the highest number of maternal fetal medicine consultants in the country. These doctors are experts in dealing with complex pregnancy conditions and problems with your baby. We have experts in all the different areas, in twin pregnancies and early pregnancy loss, in genetics, in preterm deliveries, in cardiology, in spinal problems, and all these doctors are liaise with paediatric doctors, neonatologists, and come together to devise the best plan for your baby if there is a complication or a problem with the baby. What you should do is put your trust in the doctors that are looking after you, and what you shouldn't do is Google everything you can about whatever you've heard or you think you might have heard. So you need to put your trust in the team, the dedicated teams that we have here in the Rotunda if there's a problem with your pregnancy.